AI revolution in biostatistics, future proofing in medical research, data collection, analysis, and interpretation skills. Revolutionizing in biostatistics, the power of AI to transforming biostatistics, health data sciences. Welcome to AI Visions and Novelties. Today we will bring you the state of art and advancement breakthroughs in the field of artificial intelligence and its impacts on biostatistics. Artificial intelligence revolutionizing biostatistics, making them faster, more efficient, and more effective from patient recruitment to data collection, analysis, and interpretations. AI algorithms are changing the way we approach biostatistics and improving the future of healthcare. Here's how AI is revolutionizing health data science. AI and patient enrollment. One of the biggest challenges in the health research is just the right patient to participate in the study. AI programming can analyze large amount of patients' data to identify potential participants who meet specific inclusion criteria to reducing the time and cost of patient recruitment. Additionally, AI can monitor patients' data in real time and identify new patients who meet the criteria for a research patients recruitment, helping organizations reach a large patient pool data and improve patients' outcome in study design. AI can also play a critical role in the design of research by analyzing data from the past study. AI can identify patterns and trends that can inform the design of new research study and help organizations make better decisions about research design and optimization. AI can also help identify potential confounding variables that may impact study results, leading to more accurate interpretations and a clear understanding of the efficacy of treatment and therapies. AI and data analysis. One of the most significant benefits of AI is in research analysis, the ability to analyze large amount of data quickly and accurately. AI process can automate certain aspects of data analysis, freeing up human resources to focus on more critical tasks. AI can also analyze data from multiple sources to provide a comprehensive view of research results, helping organizations make more up-to-date decisions. Huh. AI and real-world evidence. AI is also perform a critical role in the generation of real-world evidence data. AI algorithms can analyze data from electronic health records, wearable devices, and record sources to provide insight into the real world use of treatments and therapies in the research data. This transformation can inform the advancement of new treatment and therapies and be used to make more informed decisions about treatment plans and improving patients' outcome. AI and adverse events monitoring. Adverse events are a life-threatening aspects of the research data and must be closely monitored to ensure patient safety. AI can automate the process of adverse events monitoring, quickly identifying and responding to potential safety issues. AI can analyze data from the multiple sources, including patient reports, electronics health records, and wearable devices to identify patterns and trends that may indicate an adverse events, allowing organization to respond quickly and effectively to minimize the risk of patients. AI and predictive analytics. AI algorithms can analyze data from researches and record data sources to predict outcomes and identify potential risks, informing decision making and optimizing research results and interpretations. Predictive analytics and can also identify patients who are at risk of certain conditions, allowing organizations to prioritize their care and improve patients' outcome. Conclusion. In conclusion, AI is having a transformative impact on the field of biostatistics, which providing innovative solution to help data analysis and organization to achieve their goals. Although there are challenges to address such as the potential biases and AI algorithms, the benefits of AI in biostatistics are clear. By leveraging AI in data collection, analysis, and interpretations, organizations can advance healthcare and improve patients' outcome. Thank you for tuning this experience of AI inside and biostatistics. We hope you enjoyed learning the latest development in AI and how it is shaping our health data science. Don't forget to hit the like and subscribe button and stay tuned for more exciting topics. If you have any suggestion or topics you would like to us to cover, drop us a comments.